Hello, everyone, and welcome to this International Science Council and Science Journalists Forum webinar on reframing trust in science. What are the lessons for science journalism? It's presented by the International Science Council's new think tank, the Centre for Science Futures, and we're delighted to be partnering with the Science Journalists Forum to bring you this webinar today. My name is Alison Meston, and I'm the Director of Communications at the International Science Council. And as a former Director of Press Freedom for the World Association of News Publishers, journalism and the right to report the news freely is very close to my heart, as is the right to science and to benefit in its discoveries for the global public good. The International Science Council works at the global level to catalyse and convene scientific expertise, advice and influence on issues of major concern to both science and society. And we have a growing global membership of more than 240 organisations, including international scientific unions from natural and social sciences and the humanities, and national and regional scientific organisations such as academies and research councils. Advancing human development within sustainable planetary boundaries is the most important challenge for humanity and for science. And of course, we cannot achieve this without storytelling and enhancing the public value of science. You can read our story by visiting council.science, and you can sign up for newsletters via council.science/newsletter. Well, the ISC's program on public value of science has been running for a number of years, and today we'll be exploring our new report, The Contextualisation Deficit, Reframing Trust in Science for Multilateral Policy. I'm going to put this in the chat shortly. It draws on the current state of research across a range of disciplines to critique the limits of the typical science policy interface. The report suggests that there needs to be a more sophisticated approach to the way science is socialised and how we understand what trust in science actually means. Most importantly, the paper calls for more effort to understand what it calls the drivers of contextualisation in public responses to science and sets out some measures to achieve this. And our big question for today is, what role does this approach suggest for science journalism? So this afternoon, we are joined by Nick Ishmael-Perkins, Senior Consultant at the ISC and Project Leader for this paper. Nick is a journalist with over 20 years of experience in media development and community mobilisation across the Global South and is working across the Global South and is part of the award-winning team that supports the ISC's public value of science. Nick will present the report and will be followed by two distinguished respondents, Mia Malan, based in South Africa, who is Editor-in-Chief of Bhekisisa Centre for Health Journalism, and Subhra Priyadarshini, Chief Editor of Nature in India. Welcome to both of you. We'll have a moment for questions and interactions from the audience after the presentation, and this report can be found in the link that I'm just about to share in the chat. Nick, it's over to you to explore the report and tell our friends who've joined us online the thinking behind this new report. Thank you.
Thank you very much, Alison. And thank you to the distinguished panelists who've joined us and all of our audience online. We're looking forward to an exciting conversation about an area of work which is very important, I think, to all of us. Now, I am going to do a bit of an overview of the report, and there's a lot to get through. So I'm going to start by sharing my screen and just getting straight into it. There we go. So the report's called The Contextualisation Deficit, Reframing Trust in Science for Multilateral Policy. What I'm going to do is to just spend a little bit of time talking through the rationale for the paper. Then I'm going to go into some of the more problematic common approaches to addressing issues around trust and the science policy interface. Then we're going to talk about the contextualization deficit and how this relates to a more nuanced understanding of trust. And then I'll talk briefly about 4 areas for action. And I'm going to try to place some emphasis here on the implications for science journalism. Now, First, about the paper. In fact, before I do that, I should apologize in advance. Apparently, my neighbors have just started doing some work next door. So I'm hoping that that won't be too distracting. And I'm also hoping that you won't be now focused on it now that I've mentioned it. Okay, so about the paper. First, the rationale. So there is obviously concern across the multilateral policy space and also amongst organized science about the failures in the SDGs. And the idea is that this combined impact of what is perceived to be a decline in trust in science and the increasing proliferation of misinformation is undermining what should be a very effective partnership between science and policy to deliver on a range of social goods and responses to, some of society's more intractable challenges. The other thing is that we're seeing a threat to the project of multiculturalism. And this is manifest in two ways. First, actually, is through the politicization of science, which is undermining scientific consensus as an important language for global diplomacy, but also the increasing harassment and the diminishing scientific freedom, which we see reported in a number of ways now around the world. One example is a report by the Economist Impact Unit that was commissioned by Elsevier, where a third of over nearly 1,400 scientists globally said that they had seen close-hand harassment online. And what this suggests is that actually we see a diminishment in scientific freedoms and obviously also a diminishment in the right to practice science among scientists. So the paper in this regard tries to address a number of objectives. First, trying to assess these concerns about distrust, mistrust, and also the solutions that are in common practice, trying to describe the context to consider around socialization of science and science policy and society, to explore more responsive modes of engagement for the science policy interface, and to outline the implications for possible action. Also, a quick word here on the way that we decided to approach the paper itself. We wanted it to be transdisciplinary, so drawing on a range of expertise, and also to be empirical and evidenced as far as is possible through our argument. So what we have in the paper as a result are a large number of what we call, they're not exactly case studies, but really examples that we refer to illustrate the point or to kind of make meaning around what's happening. And also we have featured consultations or interviews with almost 40 peers from across a range of disciplines in the development of the paper. So now on to the substance. The first is this model that we have, which describes, we think, broadly, the mental model that is often used as a reflection of the way that science and policy interact. And this standard model suggests that there's scientific facts and technological information which are presented policy in a linear fashion with no context or reciprocal relationship with the publics. And the only role imagined for the public is to comply with science and the uptake of technological implications. And this is how public goods are delivered. Then we have a very specific framing that we provide for the issue of trust in science. And here you have this level of trust in science is correlated to public acceptance of policy decisions. And this relationship between high levels of trust and high levels of acceptance only disrupted through misinformation, which is seen as the cause of low levels of acceptance or resistance. And in that context, then the problem is seen as some kind of aggregate level of trust or distrust in science or misinformation. And that's the things that need to be addressed, really. Now, there are a number of implications around this, which are quite important to tease out. The first is that trust is measured often in surveys as an aggregate. So it's almost as if it's a quantity which is definable in any particular society. Also, science is approached as a homogeneous block. So the idea or the assumption is that people experience science as a system of practice, as opposed to an area of outputs, as it were. And then also we have this idea then that you actually turn to information management solutions to address deficits in the publics. And I just want to take a moment to say here that, in the report, we are very explicit about talking about publics because we want to move away from this conceptualization of the general public, which we see as a repeated and persistent under-conceptualization of audiences and constituent communities. And then the fourth area of implication is very much around regulation and policy framing as a one-off thing. All right, so there is some kind of engagement, a decision is made, and this is basically then about enforcement. Now, there are a number of problems around this, and there obviously COVID as a pandemic, and the pandemic provides us with some very high-profile examples of failures in the science policy interface, examples of resistance, not only by publics, but also from the perspective of policy leadership. And what is interesting is there are a couple of papers now by academics, including Melissa Leach from the Institute of Development Studies, where they talk about the examples of failure or through the COVID pandemic, reflecting more systemic and more structural failures around the translation of knowledge around the policy interface. And then, of course, we have also post-colonial critiques of the global development project, which over the last 20 years in particular has built to a growing body of empirical evidence about how we might have technological or scientific solutions which fail in their translation around social adaptation and social uptake. But for us, actually, as we were reflecting on the paper, perhaps what has been most instructive is, in fact, not so much an example of failure, but one of success. And this is around polio eradication in northern India in particular. And just to kind of provide a little bit of context around that very quickly, what we saw in 1988 was a global commitment to eradicate polio. In the Americas, polio transmission was interrupted quite sustainably within about 6 years, but in India, it took around 20 years. But it is important to explain that what we saw happen was a number of really instrumental shifts and developments around how the science policy society interface adapted. So there were 3 steps broadly around the tailored changes in an adaptation of vaccine protocols, around the redesign of the vaccine itself. So going from trivalent to bivalent. So it was actually going from just from 1, 2, and 3 type wild polio virus to now inoculating against 1 and 3 in particular. And then also the mobilization of community supporters, which was meant to respond to some very persistent narratives around the motivations of the state and global philanthropic initiatives behind polio eradication. And a lot of this was drawing on, for instance, some problematic, obviously deeply disturbing campaigns around sterilization and so on from the past. But perhaps, and what we have here is a photo of the polio eradication, and I think it's actually a really interesting photo because, in fact, here what we see is an example of how the science has come together. The life science has come together with social science around the eradication campaign. But to make sense of this polio example, I want to just step back for a moment and look at some of the things that were coming out of the surveys that people often refer to around trust. So one of the things that's really important is recognizing that levels of trust actually we saw vary to quite a high level of degree within and between countries. And we also saw that there was quite a lot of variance in terms of how people express trust depending on the particular area of science. So as an aggregate, what we would have seen in some contexts was that you had relatively high degrees of trust in areas such as astronomy, or what might be referred to as impact science, such as environmental impact assessments and so on. But then at the same time, you had relatively low trust or negative views on production science, which might include technological solutions such as genetic modification or artificial intelligence. A really interesting example, actually, of a survey that was done in Australia where you had amongst the same public group high levels of trust in climate science, but low levels of trust in COVID vaccinations, for instance. And so what this suggested was that you had quite a lot of heterogeneity in how people understood trust in science, and that context was in fact more important than aggregated levels of trust in terms of understanding how people were engaging with the science policy interface. And so what we then look towards in the report is a model that says, actually, there are a number of different factors that determine people's starting points. Then these were subject to a number of external factors that might drive responses, including things like the policy framing, access to information, the quality of information, but also, of course, perceived net benefits to individuals on particular issues. And that this in turn would determine the kind of response which different publics would provide, or the kind of collaboration, which is probably a less problematic way of framing it in terms of the high to low levels. And effectively, what we have here is some really important implications around what this means around qualifying and interrogating trust in science as a block. This in turn led to a diagram that we then started to use around what we call redressing the contextualization deficit. And there are probably a few things that are worth pointing out in this quickly. The first is really around understanding the drivers of contextualization as we describe them. And so very quickly, we talk about uncertainty in science. And I need to be really clear here about what we mean by uncertainty in science, which is to say that actually scientific inquiry seeks to diminish uncertainty. And it's not really about establishing absolute truths in all contexts. And what happens in practice, of course, is that you are working incrementally in very specific contexts. And it's very difficult sometimes because of issues around ethical considerations to be able to use tests on real life subjects. And so what we would see, as in the case with polio, the polio vaccine, is that it is understandable that there might be adaptations that are required as you start to apply science in some particular context, which is not to suggest that science is unreliable. It is really here about looking at the way that scientific practice is employed and what is expected of it when it encounters a policy interface. The other driver is around the different value systems that shape how different actors frame and investigate problems. And this actually applies to a range of ideas about what kind of society we aspire to, what sort of trade-offs might be acceptable, how you actually might even prefer false negatives to false positives in statistical tests. So there are a range of areas in which these values can have implications for science. Sorry. The third area is around science's relationship with power. And this is really around understanding that oftentimes policy leaders and political leadership will seek to engage with the global scientific consensus in a way that relates to its broader political platform. So sometimes science may be used as a way of expressing or advancing that, to leverage partnerships, to express resistance. And conversely, you also may find that different political public constituencies will engage with science in a way that relates to aspirations or political positions. And then we have, obviously, the issue of the relationship between institutions, which is really about how particular groups have experienced policy from particular spaces. And this is not limited just to institutions of science, engineering, technology, and innovation, but it could be any institution that is responsible for the rollout of any particular scientific policy recommendation. The other thing that's worth pointing out here is looking at the fact that in this model, you see scientific research and its products, such as technology, are non-linearly related, that actually the outcomes of the social outcomes of scientific innovation may shape actually what the political agenda is, what the research agenda might be. And that you see also, in fact, these social impacts determine as well the way that the science policy interface itself is, the character of the science policy interface. I just want to also take one moment to talk about, in that policy interface circle, dotted circle there, you see 4 different modalities for engagement. The framing, which is really about bringing science and policy together to establish a mandate around what the problem might be. The decision making, which is a continuous process around responding to a problem. The dialogue, actually with different stakeholder groupings, and then dissemination, which is actually really about messaging. Oftentimes in a policy interface, the focus is on the last of these, which is about the dissemination and so on. Now, implications for action in 5 minutes. I mean, sorry, in about sort of 2 minutes. This is really here about understanding that trustworthiness results from developing a kind of ongoing transparency and accountability where contexts for science's application to policy are collaboratively researched and understood. And so, in fact, these implications for action are fundamentally about understanding how we might improve engagement with the drivers in context and build a more constructive engagement with that in terms of understanding collaboration, both with policy and with publics. And so there are 4 areas broadly that we've identified. And I've tried to provide some examples here that relate specifically to science journalism. So the first of these is about building partnerships that incorporate diverse scientific disciplines and forms of knowledge, and use advice from reflexive science communication. And we use the term reflexive science communication because what we want to do is to really emphasize that we're moving away in science communication from a unilateral kind of modality, and that this is much more about deliberative dialogue type modalities, and use that really as part of shaping a relationship where the outcome could be transparency and trustworthiness. And an example of what we could be talking about here is the Transparency and Accountability Initiative, which has become such an important part of the Internet Governance Platform, provides a useful overview of a healthy information ecosystem, which we feel could inform much more science advice and particularly deliberations around the science policy interface. The second area is around developing organizations so that they embed a culture of responsive deliberation, that they apply trust markers for transparency, for instance, and increase the understanding of context and invest in more narrative listening for both virtual and offline publics. And again, an example here might be, for instance, monitoring equity and inclusion for in scientific practice and research initiatives. And that might mean looking at the policy impact, but also looking at training and participation in scientific enterprise, and also looking at data provenance. The third area, supporting deliberative processes that create opportunities for public participation and use adaptive science policy decision-making. And this point about the adaptive science policy, adaptive regulation is really important. And in the report, for instance, we have a decision tree that sort of supports how you might determine where adaptive regulation is useful. And it's really about supporting regulation as a continuous process, responding to evolving situations and allowing basically for intelligence gathering and engagement from different user and stakeholder groups. And then the fourth area, providing technical support for communication strategies, including supporting efforts to develop interpersonal trust, creating spaces for participatory development of policy, addressing key questions, particularly for national agencies and partnerships, which can lead to the increased socialization of science at the global, regional, and of course, including local levels. And here, lots of examples are provided in the report. One that might be particularly interesting is how we incentivize deliberative policy processes, drawing on the OECD Deliberative Wave database, which presents an array of modalities for deliberative policy making, and also looking at how we can develop frameworks for trust markers around research institutions and research initiatives, which draws on the EU Joint Research Council's competency frameworks as an example. I recognize that's a lot to cover in a very short space of time, but I will stop there. Thank you.
Thank you so much, Nick. And I've seen it's been quite a flurry of activity in the chat box, which is absolutely fantastic. So thank you for sharing that comprehensive overview of the new report, the contextualization deficit, reframing trust in science for the multilateral policy. And it's published online by the Centre for Science Futures, the ISC's think tank. And I've put that in a couple of times, and I'll keep doing it because it moves back up. We might have people join late. I think one of the interesting aspects of the report is that levels of trust vary within and across countries, and that trust in science means different things to different communities, and particularly around that narrative on somebody might trust climate science, but they didn't trust the COVID science, and what role does journalism have to play in that? So yeah, let's take this let's go to Mia, who is well versed in the science of health and trust. So Mia, it's over to you in South Africa for some reflections on Nick's presentation, and maybe just give us 30 seconds or so about your organisation in South Africa so we can have some context. Thank you. Mia, if you can unmute, or Moez, if we can have Mia unmuted, please.
Thanks very much, Alison, and congratulations on a great report, Nick. So I am based in Johannesburg in South Africa, and I head up an independent media organization that is called the Bhekisisa Centre for Health Journalism. Bhekisisa means to look very closely at something. It is a Zulu word in South Africa. It's our largest language here. And we report on health issues in the country, mainly around health policy. So we bring science and policy together in our reporting and try and make sure and hold the government accountable to have evidence-based policies. Now, what I really liked about your report, Nick, was that it pointed out the contextualization of science. I live in a country that has 11 official languages, which should be an indication to you as to how many ethnic groups we have here. And that means that there are many different perceptions of science in the country. And if we as science communicators and journalists don't take that into consideration, then we're not going to contribute to the uptake of, say, evidence-based medicines in communities. And I think a very recent example of that is the HIV prevention pill, which can virtually reduce your chances of contracting HIV to zero if you take it every day. And it was rolled out in Africa, started 10 years ago, and the uptake of that has been pretty slow. And you would think that if you give someone a pill and say you won't be able to get HIV, that they'll just run for it. But that is, of course, not how medicine works. The science is just one part of it. Getting people to use evidence medicine is an entirely different ballgame. And that's where the media plays such an important role. And if we don't do our jobs in that regard, we end up with policies which are based on prejudice rather than evidence. And an example in my country of that is, many of you may recall, in the late 90s, early 2000s, the president or the government that we had at the time didn't believe the science of HIV. They didn't believe HIV caused AIDS. And as a result, the country didn't have free HIV treatment, which led to hundreds of thousands of deaths. And that decision, that policy, was based on prejudice, but not necessarily malicious prejudice. They were things playing out around the context of, we were a colonized country, and that meant that there was huge distrust of science from the Western world. And those things need to be taken in consideration when you report on an issue like that. And a recent thing is the Omicron travel bans. There was no evidence to show that if you keep one part of the world out of another part, Africa had the travel bans installed or implemented against them, that would slow down the spread of a new variant. So essentially, the media there also had a very important role to play to expose or to report the correct science. So what we did during COVID at Bhekisisa to build trust was, I think, the most important thing was that we learned that consistency is the currency of trustworthiness. Consistency in terms of getting things right, but even more importantly, by reporting them in a way that people can understand, which I think is even more difficult than getting things right. I think it's a very acquired skill, and also to use the mediums that people access information in. There's absolutely no sense in getting things right and writing it in the right way so that people can understand it and then sending it out on channels that people don't access. And by that, I mean that in today's media world, you can no longer claim as a science journalist that you've done your job when your story has been published on your website. There are many other ways that people today access information, and social media is a very big part of that. So during COVID, we saw people doing Twitter threads, for instance, that's shifting to Instagram stories and TikTok stories. And you can't say, I'm a science journalist, I'm serious, I'm not going to be on TikTok. You need to be there and you need to find ways to distribute information in that way. And to end with an example in South Africa that would really require contextualized reporting is that when it comes to medical male circumcision, for instance. In my country, many groups in my country do traditional circumcision. So when medical male circumcision was rolled out to reduce men's chances of acquiring HIV, it happened within the context of communities already circumcising, but not necessarily in the same way for which there's evidence to prove that it prevents HIV infection. So if you went into a rural area in South Africa to a community, say the Xhosa community in my country, where there's lots of traditional circumcision and it's not used to prevent HIV infection, it's a passage into manhood. There was a lot of resistance against medical male circumcision. It was seen as Western science being opposed onto communities who, in their opinion, was already doing the thing that the Western world or Western science now wanted to use to prevent HIV infection. And in that context, it required a huge sensitivity to incorporate the views of traditional leaders and when you went to a community to take that into consideration. Because in Africa, traditional leaders are policymakers. They decide what happens in their communities, how it's happened, what's allowed, and how something is going to be rolled out. The government can't just come in there and decide how they're going to do it. So that is a example of something that has had huge contradiction in my country and difficulties. And when there was a lot of botched circumcisions, it often happens during December, you would think that it would be easy to get a medical doctor to train a traditional circumciser. It is not, because there are cultural issues around that and involved. And if you don't address that, you're not going to get very far. So one of the issues, for instance, is a traditional circumciser is not going to listen to a doctor if that doctor is not of the same ethnic group and if he hasn't been circumcised. And if that is not incorporated in a program that tries to roll out medical male circumcision in an area where there is traditional circumcision, the science would simply not be accepted. To end off with, in something that I think is very important in building trust, and it was pointed out in your report, is that if your office where you report from, your newsroom, doesn't reflect the country or the demographics of your country that you report on, you will be far less equipped to know how different people in the country perceive science and what are the contexts that you need to incorporate in your reporting. So we try at Bhekisisa, because in South Africa we're such a diverse country, to have reporters from rural areas, reporters from most ethnic groups, reporters from all ages, all sexualities, all genders. And that helps us to have a much better grasp on what could the potential challenges be, but also people in my newsroom ask questions that wouldn't have been asked if all those groups weren't represented, and that helps us to incorporate it into our reporting. Thank you.
Thank you so much, Mia. And again, I think you've touched on that notion that this paper really explores about the publics and what it means to be responding to the different ideas around what does trust mean in science in your particular public. And you've mentioned that you have 11 languages that are official languages in South Africa, and what does this mean in those different points of view, to have a broader public policy perhaps on a response like COVID, which we might have time to explore later. Well, let's go from South Africa over to India. Good evening, Subhra. Thank you so much for joining us in your late evening. Tell us your thoughts on perspective from being an editor of a very well-respected journal such as Nature. What are your thoughts on trust in science, not only from a scientific journal perspective, but also from a perspective of another broad democracy with many different types of publics?
Thank you, Alison, and thank you, Nick, for that lovely report. I do think that really sums up what we do as journalists in our daily lives, in our avatars, as communicators of science. I belong to the magazine side of the Nature portfolio, which is more journalistic, more content, which we call the front half content, rather than the manuscript or the editing of those. So I feel like the best way to approach the report itself and to the ensuing conversation that's happening is to look at what the context of the SDGs is in our countries. And Mia talked about languages. We have 22 official ones and 270 across the country. So that's a huge diversity again. And I do think that the social context here is in the context of how politics plays into all of the stories that we do especially in the subcontinent in India. And the points that have been made so far are actually extremely sobering for somebody who essentially makes a living out of selling science to whoever is caring to listen. I'll just resort to some common sense here, something that appears very, very commonplace to me, being in science journalism for close to 25 years now, building a sort of bridge between the ivory tower science and its beneficiaries, the public, or the publics that we are talking about. So at the heart of trust for me is empathy. Mia talked about consistency. For me, I think it is empathy, a match of wavelengths, even compassion. Why do you trust someone or something with your life? If you think of just one name or one person that you trust, it isn't difficult to figure that you do so and not just because they are a repository of knowledge or are making mankind proud with their discoveries or just highly skilled or regarded. You do that, you trust them because they have assured you that they are trustworthy over a period of time, investing their time and energy in making that bridge with you. And there has to be some deeper connect at an individual or community level for you to really repose your trust in anything or anybody. So why do we think it ought to be any different for science or scientists? So the common sense thing about trust is that it has to be built, one, over time. And we have heard it said very often that you have to earn somebody's trust. So this leads me to the broader notion of good faith upon which science and medicine both thrive. And science, of course, evolves. Science has many caveats, many unknowns. All of this needs to be communicated well and with a very humane approach. that is not to throw science or evidence at unsuspecting masses and say that you've got to digest this information, whatever it's worth, but maybe communicate the uncertainty, the vulnerability of science along with its rigor, and make it more human, provide an empathetic reason for why it's going to make sense to go with evidence. The other common sense thing that is now the bane of science virtually is its inaccessibility. And I've seen on the chat people talking about jargon-laced science. In many ways, it is not just cut off from day-to-day life, meaning the Science Society Connect with its jargon, but there's also a public perception that science is highbrow. It can be understood only by specialists. Part of the problem, again, is the language of science, which we've been talking about, which is the technical and jargon-laced, primarily English in large parts of the world kind of science communication. And contesting that is the simpler fake news option or misinformation, which seems much more attractive to the public, which is catered in formats and languages that are way more accessible, right? So there's a question for all of us to deal with there. The other question I want to raise is, who should be entrusted with the task of making science trustworthy? As of now, the onus of building trust in science rests largely upon scientists. We just heard about the challenges of why that is a difficult proposition. The argument that I have most often come across from scientists is that we do science and we have very little time for public engagement or even activism for any kind of policy change to happen. And that would be a legitimate and perfectly sane argument if they were not doing their science with public money, right? But they do. But then I'll add that it should not be mandatory for scientists to have another role to play in communicating their science. I'm sorry, I have a very bad throat.
Do you need to take a break, Subhra?
No, that's fine.
You're okay.
That's fine. But I do think that scientists don't have the training to communicate that science effectively in a way that people can really understand that language. And that is the space of science communicators, of journalists, to be advocates of science. And I do think that these roles are very complementary to one another, feeding into each other. So the essential training that all scientists surely must have, to my mind, is to be able to reflect the love and passion for the individual disciplines when there is need. And we've talked about COVID-19, we've talked about similar situations in the polio, last mile connectivity. And who did the polio last mile connectivity? It was very cleverly done by cultural actors. There were religious people who were brought in to do that communication. So really to step up the game, surely in times of emergency such as a pandemic, when the world is looking at science for answers and is willing to invest in trusting science. That is a challenge for scientists, but that is also a moment to seize in history for all of us to see how science communication can be done in a way that transcends these barriers that come in front of scientists and science communicators. So I'll rest my case there.
Thank you, Subhra. And we have about just under 15 minutes to have a discussion, and I note some questions are coming in. It's really great to see the level of discussion that's happening in the chat. Nick, let's start with you. What are your reflections on the respondents' thoughts? We've heard Mia talk about the challenges for a country like South Africa around having 11 official languages. We also heard this from Subhra, the different publics within a country, and that you might only take advice from someone from your particular ethnic family. But we also heard Subhra talk again, a theme that I think has been coming up for many, many years about the fake news option and how do we make news trustworthy without jargon. And I note that we've had some questions about this in the chat. So would you like to talk briefly about these points?
Sure. Thank you, Mia and Subhra. I think I'm going to start with Mia. I think, South Africa is really interesting. Mia referred to an example that I was hoping she would around HIV, but also I think that your reflections around circumcision are really instructive for lots of reasons, because, it's particularly challenging, first of all, because it makes clear that, in fact, we're not talking about science journalism or science communication in a deficit, because, in fact, we see that there's already a practice and a very long, well-established practice of male circumcision in many communities. And I think, so it's a really instructive example, because, in fact, you still have this notion of kind of, well, the public don't really know, they don't know anything, we need to tell them. And I think that example that you've given is a really clear example of where, well, no. They do have some very clear ideas, actually, themselves, about, based on their experience and their values, about what works and what doesn't work, and you have to be able to engage with that. I thought it was extremely interesting, Mia's observation as well, about, very simply, about making sure that you have reporters and journalists who reflect the context that you're trying to both report on and serve. And I use serve here very consciously. And because, as Mia says, they ask the right kinds of questions, again, to reflect the contextual understanding and the contextual needs. And one of the things that I really want to say is that it's very true, actually, as a science journalist these days, it's not enough to write an article and put it up online and think, okay, my job is done. And in fact, one of the things that we try to say in the report is actually, it goes even further than that. This dissemination stuff, it's really one of 4 different areas of engagement that we need to be thinking about. We talk about framing, which is actually about the understanding of what indeed the problem is, what you're trying to fix, or what is it that actually science and policy are trying to engage around. And this idea about actually decision-making, that you have a body of knowledge that's being interrogated, that's constantly being refreshed, and that is shaping basically the interface. And I think that, again, science journalists have a really big role to play there around maintaining accountability around that, and the supply, as it were, of transparent, interrogated research knowledge. And of course, the dialoguing, which I referred to earlier. The other thing actually about the report that's interesting, this now brings me on to what Subhra was saying, is this idea of the policy. Because I think often when we think about the science communicator, science journalism, we think about science to public. And I think it's important to think about the policy dimension within that. And in a way, not to overcomplicate this too much, because I think, as Subhra was saying actually there, particularly in her last few moments of remarks, when you look at the role that, for instance, religious leaders or, opinion shapers, real community leaders are taking, that is not to be taken lightly, because that is also shaping the political or the policy platform. Because, of course, we must remember that these policy leaders, they are coming basically within embedded, entrenched patronage systems. And we need to be mindful of how we're engaging with that. The question about, just very quickly on this issue around kind of how do you deal with jargon, I think that there are a couple of things here. One is that there's a quote that we have actually in chapter 4 in the report, where we say the role of science communicators now is less about explaining science to the public and more about helping scientists and technological entrepreneurs to understand societies that they're meant to be serving. And if we think about that, I think it helps to shift the fixation we have around jargon and explaining jargon, because it's true that is a part of it. But I think we need to engage basically as science journalists, thinking this is about enabling the quality of the interface that we have. So it's really about supporting actually scientists and that science policy engagement, as much as it is about explaining what's going on with what's going on with the body of knowledge around science and this kind of particular epistemic community and their language and so on. I'll stop there.
Thanks, Nick. And we don't have very long left, so I'm going to put two questions to the panel. So the first is, and again we've touched on this, about are journalists in a place professionally or otherwise to reflect the drivers of that contextualization that we've talked about today. So, for example, based on journalists' professional training and experience, are journalists equipped, and do they have the capacity in an era of stressed business models to communicate the big picture context of the news they're reporting, or do we have to find a way forward with scientists and their ability to be communicators? Because as we know, just because you're a great scientist doesn't mean you're a great communicator. And the second question is really, this has been coming up on the chat a fair bit. It's really about politicians and decision makers, or those who are in a position of power to make decisions. How can journalists and storytelling promote and drive, evidence-based solutions for decision makers? What role do we have, and how can people use this report to assist that? Who would like to tackle either one of those questions? Mia, do you want to have a go? And then we'll go to Subhra.
Yeah. On the question of do journalists come equipped to contextualize stories today, I can only speak for South Africa, really. And my answer would be no, they don't come out of journalism school equipped to do that. So the way to build that is through mentoring in a newsroom. If you have the resources, I'm lucky that we don't have to report on daily news, so we can do it at Bhekisisa. But it is an incredibly time-consuming process. You'll be shocked that we edit between 15 and 20 hours on a 1,500-word article. And about half of that time is spent on dejargoning. It's one thing misinterpreting a study. It's another thing interpreting the study correctly, but writing it in a way that, let alone no one understands. It's just plain boring. There is a lot of skill that goes into, it's not just replacing words, it's breaking down concepts, it's, like you say in your report, contextualizing them, using an analogy to explain something. And I find with myself is the less I understand something, the more jargony I get. So you need to make sure that journalists understand that. An interesting thing that happened during COVID was, you can't really, I think we all learned during the pandemic that you can't really, when everything has to be done faster than usually, you can't do it by yourself. Yeah. You need partnerships. And one of the partnerships we developed was obviously with scientists. They helped us a lot to make sure that we get things right. And a partnership that developed as a result of that was that we started to do training workshops and training them on how to communicate their own science. And we do about 1 or 2 a month now at Bhekisisa as a result of that. And it's really a mutual learning experience. When we have a day-long workshop, half a day is about dejargoning. And of course, like part of that is understanding the community in which you operate.
Thanks. Subhra, what kind of comments do you have around those two questions that I've been told by Aleem in Pakistan that they were too hard, but I'm sure that you can respond.
Yes, I do agree with Mia that dejargonizing and deflating the egos of some writers, that they understand the subject so well that they can do away with, they can't do away with the jargon. It dumps down their science. So that is the biggest challenge that we also face. So this to and fro between science writers, scientists, and editors in our newsrooms is a real challenge. Having said that, I do feel like science journalism, much as we all might want to think otherwise, is still a greenfield. It's still something that's fledgling as a profession in most countries. The first the first bureaus to get the axe in a newsroom would be a science bureau, if there exists one.
If they exist, yes.
Yeah. And then So, I think that upskilling and upscaling of science journalists is one of the tasks that all of us have set ourselves with, mentoring more and more people who want to come into this profession, trying to do things around how to create more of us and how to create better of us. So, so those are the things that we as science journalist associations across the world have also taken upon ourselves. I feel like one of the things that is very, very important for science journalism fora or science journalists to understand in today's day and age is that it is not looking at a particular story from the lens of just science, but also making it the hydra head of politics, economics, social context, everything that comes together to become a story. And before we sell it to the publics, we are actually selling it to our newsrooms. And to get a space in our newsrooms, to get a space for science in our headlines, it will be necessary that we create those hydra heads for each of our science stories and don't label them as science stories. We label them as stories which has bone of evidence. I think that is one thing that I take.
Critical thing. Thank you, Subhra. We have a minute left, but I just wanted to share a question from Hari Krishnan Tambi, who has written quite an interesting back story to their question. But they do ask, do we just do what we've always done and hope for the best? And so I think, Nick, I'm going to hand that over to you for food for thought. And how would you respond to this question as we close our session?
Thank you, Alison, for that dubious privilege. I want to just start, though, by saying, just in 5 seconds, that I really applaud what Subhra just said, this idea of the five-headed sort of approach to science stories, for 2 reasons. One is that actually I think if there's one thing we take away from this report is that science, it's not going to get the kind of partnership that we know is required to deliver results to some of the society's most intractable problems if we do not have a partnership that considers different dimensions and socializes the science exactly in the way that Subhra said. The other thing about that is that actually if you approach science stories that way, they become more interesting because then they become a little counterintuitive. And that is where you can get into the mainstream and where you will be able to raise the agenda. So that's what I wanted to say. And in that regard, do we do more of the same? Well, I think that depends, because again, to maintain the ethos of the report, I don't want to suggest that everybody's doing the same thing everywhere across the world, because of course there are different contexts, whether they're institutional or geographical or cultural. So it's difficult for me to say whether or not everybody should continue doing what they're doing. But what I can say is that there are certain signals that are worth being aware of. Thank you.
Thank you, Nick, and I'm very conscious of the time. And can I thank Mia Malan? Can I thank Subhra Priyadarshini? And can I thank Nick Ishmael-Perkins? And lastly, can I thank the wonderful contributions that we've had and the lively chat that we've had? We're looking forward to further engagement with you. And again, I put the report in the chat, and we can just thank everybody for a wonderful session. If you weren't able to attend today, or you have friends, I'm sure you can send them the recording. And we look forward to a positive view of the world as we share our stories and to find solutions to living sustainably on our planet. Thank you, and good evening to all.